Good evening. Tonight I am here to talk to you about fetal alcohol syndrome. Fetal alcohol syndrome is the leading cause of intellectual disabilities in the United States. Fetal alcohol syndrome is caused by exposure to alcohol in utero and is completely preventable. The problem is that for an alcoholic, it's not easy to quit drinking, and it can be extremely dangerous to stop without medical interventions. Fetal alcohol syndrome is a lifelong struggle for the individual with many lasting effects. So what is fetal alcohol syndrome? Well, fetal alcohol syndrome is a permanent condition that can occur when a woman drinks during pregnancy. A syndrome is a group of symptoms that happens together as a result of a particular disease or abnormal condition. Even consuming small amounts of alcohol during pregnancy can damage the developing fetus. Alcohol use during pregnancy can interfere with the fetus's development, causing physical and mental defects. Fetal alcohol syndrome is the most severe condition in a group of conditions known as fetal alcohol spectrum disorder. One reason that alcohol is dangerous during pregnancy is that it is passed through the woman's bloodstream to the fetus through the umbilical cord. The fetus cannot metabolize alcohol the same way as an adult, so it stays in the body longer. Alcohol can interfere with the normal development of the fetus, especially the brain and the central nervous system, which can cause a variety of problems. Alcohol can kill cells in various parts of the fetus, which can cause abnormal physical development. Alcohol can interfere with the way the nerve cells develop and how they travel to form various parts of the brain and their functioning. Alcohol can also constrict the blood vessels, which slows down the blood flow to the placenta, the fetus's food supply while in utero, which causes a shortage of oxygen and nutrients to the fetus. The toxic byproducts that are produced from the body processing alcohol can build up in the baby's brain cells and cause considerable damage. The damage from alcohol can happen at any point throughout the pregnancy. The start of fetal development is the most important for the whole body. However, organs such as the brain continue to develop throughout the pregnancy. It is impossible to determine the exact moments of all fetal development during pregnancy, which makes it extremely risky to consume alcohol at any time throughout a pregnancy. What are some of the symptoms of fetal alcohol syndrome? Well, the signs and symptoms of fetal alcohol syndrome can vary. One person may only have a few symptoms, while another person may have all of them. Fetal alcohol syndrome can cause mental and physical symptoms, which can create significant challenges for the person. A person with fetal alcohol syndrome can have noticeable difference in their facial appearances and with their limbs. They may also have delays in the way that their bodies develop over time. A person with fetal alcohol syndrome can also have mental and emotional challenges throughout their lifetime that may impact their social life, education, and work. In infants, symptoms can include abnormal facial features that can include a small bridge between the nose and the upper lip here, a thin upper lip, and smaller eyes. Infants can also have low body weight, shorter height, and have difficulty with sleep and sucking reflex. They may also have a small head size and vision or hearing issues. There are also symptoms that can develop over the span of a person's lifetime, which can include the following: delayed speech and language development, difficulty concentrating and short attention span, difficulty telling the difference between reality and fantasy, hyperactivity, learning disabilities, low IQ, poor coordination, poor reasoning and judgment skills, poor school performance, and poor short-term memory. So how is fetal alcohol syndrome diagnosed? It can be hard to diagnose fetal alcohol syndrome. There are no specific tests for fetal alcohol syndrome, and due to the fear of child protective services being involved, Most pregnant women may not give information about their alcohol consumption during pregnancy. A pediatrician can diagnose fetal alcohol syndrome from the size of the infant and through specific physical features that develop throughout childhood. The best way to diagnose fetal alcohol syndrome is through a complete history of alcohol use during pregnancy from the mother. There are other ways to diagnose fetal alcohol syndrome, which include looking for the following. Again, the abnormal facial features, which includes a smooth connection between the nose and upper lip, a thin upper lip, and small eyes. Small size at birth and throughout childhood. And emotional and behavioral issues like difficulty paying attention, hyperactivity, and poor judgment. So what is the maintenance and treatment for somebody who has fetal alcohol syndrome? There is no cure for fetal alcohol syndrome. A child born with fetal alcohol syndrome will have the symptoms for their entire life. Some of the symptoms of fetal alcohol syndrome can be managed by treatment from a healthcare provider. However, they will never go away. Some treatment options include using medication to treat some of the symptoms, such as attention and behavior issues, behaviors and educational therapy for emotional and learning issues, and specialized training for parents to help them work with the symptoms of fetal alcohol syndrome. There is not one particular treatment that is right for everyone with fetal alcohol syndrome. For some people with fetal alcohol syndrome, the best option is just to monitor their progress throughout their entire life. Parental training is used to help parents and families cope with behavioral, educational, and social challenges. Parents learn different routines and rules that can help the child adapt to different situations. Often, having a stable, supportive home can help children with fetal alcohol syndrome avoid developing mental and emotional difficulties as they get older. There are also certain protective factors that help reduce the negative impact of fetal alcohol syndrome on a child. These factors can include being diagnosed by the age of 6, the absence of violence in the child's life, a loving, supportive, and stable home environment during the school-aged years, and the use of special education and social services throughout school-aged years. There are also secondary effects of fetal alcohol syndrome that a person will experience over time, especially if the fetal alcohol syndrome is not treated through childhood. These effects are called secondary effects because they are not a direct result of fetal alcohol syndrome, but happen as a result of fetal alcohol syndrome. Some of the possible secondary effects include experiencing mental health issues, getting into trouble at school or with law enforcement, spending time in a mental health facility or a substance use treatment facility, or in jail, acting inappropriately sexually, having difficulty living on one's own, and having difficulty getting and keeping a job. The best way to prevent secondary effects is for the person to begin receiving treatment as early in childhood as possible. What is our government doing to improve fetal alcohol syndrome? Well, the federal government is taking steps to reduce fetal alcohol syndrome through a variety of programs and initiatives that include prevention, screening, and treatment. The government is working to reduce the incidences of fetal alcohol syndrome through the following intervention programs. Public education, which helps to educate the public and policymakers about fetal alcohol spectrum disorder and how to reduce alcohol use during pregnancy. Point of sale warnings. This encourages warning labels on alcohol containers and in alcohol serving establishments. Primary prevention. This is looking at developing prevention materials for Native Americans and Alaskan Natives. And positive messaging, which encourages messages that focus on a healthy pregnancy and the importance of prenatal care throughout the entire pregnancy. The government is also working to reduce and improve the outcomes of fetal alcohol syndrome by educating primary care providers about the risks of drinking during pregnancy and by providing behavioral therapy interventions as part of primary care. The government is looking to assist with the symptoms of fetal alcohol syndrome by utilizing the following treatment options. For treatment approaches, we're looking to support the development of treatment approaches using dietary supplements, metacognitive strategies, and sensory motor training. Treatment facility locators. This assists people in finding treatment for substance use disorder through SAMHSA's findtreatment.gov. It also helps people find mental health services and specialized services for those struggling with some of the more significant side effects of fetal alcohol syndrome. The federal government is also researching ways to prevent fetal alcohol syndrome and reduce the symptoms in several ways. The government is funding research in fetal alcohol syndrome prevention, diagnosis, treatment, and etiology. The government is also looking to identify maternal risk factors associated with fetal alcohol spectrum disorder. The government provides free online training courses on the prevention of prenatal alcohol use. Fetal alcohol syndrome is preventable, but it is a lifelong condition that can be prevented through abstinence of alcohol by the mother throughout the entire pregnancy. It is important for the mother to be open about her alcohol use to either prevent fetal alcohol syndrome or to diagnose fetal alcohol syndrome as soon as possible so that treatment can begin early. Through education and support, fetal alcohol syndrome can be completely preventable. Fetal alcohol syndrome can be treated, however, it can never be cured. With support and early intervention, a person with fetal alcohol syndrome can live a long, productive life. Thank you, and have a good evening.